Hello and welcome to the latest edition of Here for Good, where we explore how transformational leaders create a positive impact on the world around them. Throughout history, inspirational leaders and organizations have always used the power of words to connect with emotion, galvanize communities, and enlist others in causes for change and good. At Virtua Health, we are changing the way people think and talk about health and well-being. So it is our privilege to tee up meaningful conversations with engaging social catalysts and thought leaders. Please welcome our host, Dennis Pullin, President and CEO of Virtua Health, as he sparks today's exciting conversation.
As the coronavirus epidemic spreads across the nation, many of us have tried to sift through the endless barrage of information. Between news reports and social media and discussions with friends and neighbors, it can be difficult to determine what's credible and what's not. As is often the case, we have ended up turning to the experts, and in this case, the scientists and doctors, and in particular, those with expertise in infectious diseases. There's no better time than now to talk with Dr. Martin Topiel, the head of infectious diseases at Virtua Health, where he's part of a team that is helping our community cope with the COVID-19 virus. He received his medical degree from NYU Medical Center and has been in practice for nearly 36 years. His experience includes caring for the anthrax patients during the outbreak in 2001, and he served as a medical expert for the Today Show, Dateline, and many other news outlets on topics ranging from influenza to Lyme disease. Dr. Topiel, welcome to Here for Good.
Thank you, Dennis. It's really wonderful to be here and to have the opportunity to really communicate with the community.
Well, great. Well, let's start by helping our listeners, our community, as you say, understand exactly what it means to be the head of infectious diseases for a health system. What do your responsibilities entail?
Well, in a very broad way, it's looking at maintaining the safety of our patients in the hospitals, the safety of the people in the community, and also the safety for our staff who work so diligently in our hospitals. We're all familiar with contagious diseases like staph infections and infections known as Clostridium difficile. And those are the kind of things that when I go to sleep at night, I typically in the past worry about. But now the process has totally changed where we are today, and the emphasis on safety can't be overstated anymore.
And I think now the general public have a much greater appreciation for the things that you and many of your colleagues do. And speaking of colleagues, a few weeks ago, the general public probably had never heard of Dr. Anthony Fauci. But today, he's sort of the face of the federal government's response to the coronavirus. Can you share your experience with him and perhaps some insight into how you believe he's approaching the way the government is responding to this pandemic?
Yeah, that's really only my pleasure to, Dennis. When I first trained at George Washington University for my infectious disease training, I had the opportunity to meet Dr. Fauci a number of times as he was presenting lectures and grand rounds. And I couldn't have met a more modest man, but a more brilliant man. He is a very rare breed of somebody who not only is an excellent scientist, but an outstanding clinician. And we don't usually find those two melded up. And so in that sense, he's very unique, obviously a very clear, concise communicator. And he is the source of truth, and it's always been that way.
You mentioned source of truth. He has definitely demonstrated and created a sense of confidence that I think the general public now have in him as the person that many have looked to for, as you say, the source of truth.
Yeah, I think somehow his character is a sort of he has a modest way about him, but he's able to be concise in his presentation, and that combination really helps somebody communicate. And I think it's something important for us all to learn.
So when we first started hearing about COVID-19, a lot of people dismissed it as being just like the flu. And I think we now know that, many people have died each year from the flu. But can you expand a little bit on how these two viruses are alike and, more importantly, how they're different?
Well, we're still learning that, Dennis, and I think that's part of the problem. Influenza's been around for years. It has what we call an antigen, which sort of is an expression of the virus. And the antigen wavers year by year, but most people have some degree of immunity to those antigens that are present on the virus. The problem with COVID-19 or coronavirus is that it's a new virus, a novel virus. So the antigens that it has, no one has antibodies to. As a result, that's why it's so devastating when it presents itself to people.
Is this a type of virus that will change or mutate such that if we see it perhaps again in the fall or next year, it might be somewhat different than what it is today?
Well, I think that's very insightful on your part. We already know there's 7 or 8 different strains that are circulating. And it may be that some of the strains are more pathogenic or even lethal than some of the other strains. That's something the scientists are really looking at right now.
So you're right. But we've come to understand that this is a respiratory virus. With all the drugs and treatments that we have, why is this one so hard to treat?
So it's really interesting that you say that. I think the initial communications were about this being a respiratory infection. What we're finding even now as it's coming into our community is we're seeing all sorts of presentations, even with gastrointestinal manifestations, sometimes with just muscle aches and chills. So, number one, it's hard to necessarily differentiate all these non-specific symptoms in one versus another presentation. Uh, I think the other thing that makes it a little challenging is the fact that asymptomatic people seem to be carriers and can be infected. And we have no way of truly evaluating those people. And they're contributing to the contagious aspect and spread of infection.
But Marty, we know and we've been told that there are certain conditions that put people at higher risk for complications from this virus. What are some of those conditions and what can people with them do to better protect themselves?
Right. So, first and foremost, we have to be very diligent in not only protecting ourselves from a respiratory status, but washing our hands diligently, disinfecting things we might be touching. Uh, and that's because, especially those people with those kind of conditions you're talking about, have to be very obsessive. So, people with significant cardiac disease, people with underlying diabetes mellitus, those are the two major conditions, along with underlying lung disease, that people seem to be able to have real challenges once they get the infection. Uh, in addition, those disorders we kind of classify as immunocompromised disorders, whether it be a lymphoma, somebody undergoing chemotherapy, somebody on medications like biological modifiers. There's now a large group of people who fall into this basket. And
What about dispelling some of the misnomers? You hear a lot when we're talking about those that are predisposed as a result of age, but then also there for a period of time where a lot of our our younger people thought that they were immune, and so we saw in the news more often than not a lot of the younger population still going out, still being on the beaches and still congregating in large groups because they thought they were not as vulnerable to the virus. Can you speak to that a bit?
Well, that's really problematic. I think some of the information we first got from China was, yeah, this is all about the elderly. But we are finding through New York, through New Jersey, we are finding very sick people who are between 35 and 55 years old. And I don't know that there's any true difference. I'm sure the elderly are much more prone, but we are seeing people of younger ages for sure developing significant infection. I think part of the problem initially was we weren't able to get good data from China. And in addition, it may be that our strain is slightly different. So those things could lend itself to different people getting infected and different outcomes.
So as we see the infection rate at some of our nation's nursing homes, is that a result of age being compromised or having a lot of underlying? Because for a period of time, people thought that only those in nursing homes were most vulnerable or at risk. Is it that they just happen to be sort of the perfect storm for this virus to take over?
Absolutely. I think the age factor certainly very high risk, lots of underlying morbidity and disorders. And while various nursing homes can do a great job in terms of their infection prevention and environmental cleaning, I don't think they've ever been faced with this kind of devastating disorder. So it is a perfect storm. They're really set up for our problems.
So what about the 80% of the people who will get a mild case of this and just really need to stay home? What can people expect about managing their symptoms and, more importantly, protecting the rest of their household? Because what I'm told, people are more inclined to be infected by a loved one or someone that lives in the same household.
Yeah, the concept of self-quarantine is a very difficult concept. As Americans, we're very free people, and no one is used to what self-quarantine means. In addition, there's articles and data studies coming out now that shows these large droplets, which contribute to the contagion, can even exist in environmental surfaces for a while, can even exist outside the room you might be in after you open a door.
Define what you mean by a while. Some people, and I've heard, 30 minutes to several hours. Do we even know?
Well, we know surfaces on cardboard have been able to isolate the organisms after 24 hours. Yeah, so that can be a little raising questions. However, we don't know what that is, the significance. An article just came out yesterday from the University of Nebraska, where in the hospital rooms, they were able to isolate organisms on various surfaces, even despite great environmental cleaning, and even found it in the hallway outside the hospital room of the patient. So this is a challenge that we've never really faced before.
Those of us that are in healthcare, and particularly those of us in administrative roles, we're trying to keep up with information and the flow of information and the changing of information from the CDC and other governing bodies that we're finding things are changing pretty rapidly. And so we have a lot of healthcare workers and others are wanting clarity around, you talk about self-isolation. Initially it was 14 days, and then it was 7, and it was being symptom-free for X amount of time. Where are we right now when we look at those folks on the front line that are putting themselves between harm and the health of a nation and trying to be impactful. How can we better communicate to them what many of these changing guidelines are? Or maybe you can just speak to why we see some of the guidelines changing so frequently.
Right, right. And boy, isn't that an excellent discussion point and question? And we have to be the source of truth. We have to have transparency in order for people to band together and really fight this all together and provide their safety. Um, we still follow CDC guidelines at Virtua, but the CDC has realized over this last 3 months, because of the supply issues, because of staffing issues, that the 100% perfect situation is not going to exist. And that's no one's fault, certainly within the hospital. We have been dealt a set of cards, and our national stockpiles we thought that existed don't seem to be quite as available. So we need to work with the materials we have. And the CDC itself says if you don't have these supplies, try to reuse this or try to disinfect that. And we're following those CDC guidelines at all times and try to explain to the courageous staff that we have that this is an evolving process that we deal with on a daily basis to try to meet their safety.
So the last pandemic of this scale was the Spanish flu of 1918. What can we learn about these two events that happened almost 100 years apart?
Well, what's the saying? If you don't know from history, you'll just repeat it. And I think very much that's what's going on again. We knew this would happen, but we weren't quite as prepared as we thought. I've done a fair amount of reading about that pandemic because I thought it would help us navigate our health system and as well as work with our community members. And in fact, the Philadelphia area, Delaware Valley, was devastated by that 1918 flu because they had parades at the time and the town was infected. And I think Philadelphia had the worst devastation of any city in the country. On the other hand, there was a town in Colorado named Gunnison, Colorado, which was extremely strict on its quarantine process, built barricades along their roads, jailed anybody who tried to get into their town, and they never had one case of influenza during that. So there is a lot to learn from evaluating history, but it speaks to the importance of the self-quarantine, the quarantine process. And of course, we also learned during that time about the second wave, which existed approximately 6 months later.
So have we been able to do, I mean, that's great from a historical perspective, but most recently, have we been able to have knowledge transfer from many of the lessons that were learned either in China and South Korea and the state of Washington? Have we been able to transfer some of that knowledge and change our behavior and our policies and procedures in terms of managing things now?
Isn't that really interesting? I mean, we're looking at society. Those that have more authoritarian governments have the ability to have better controls on the quarantine. It's my understanding in China that a husband and wife cannot both go outside of the house, that they're very restricted, that they have modern apps on their phone that they can be monitored if they're moving. On the other hand, in the United States, that seems like an impossibility. We have been a wealthy country that our people think we're invulnerable. It's a real conflict. So we're going to see how the Great Society really is.
So let's speak hypothetically here for a moment. Let's pretend that my podcast is just hugely successful, and you are the single source of truth. And this is the only vehicle that the entire US of A gets their information. What would be the most important message you would want to deliver that people could walk away with from this conversation?
Well, that's a very powerful opportunity.
It's a powerful podcast. Everybody's listening.
I don't doubt that. So I think the first thing that you brought up is very important. This is just not like the flu. There's devastation going on. We need to take this incredibly seriously. And the way to do that is to provide a discipline to ourselves. We don't need an authoritarian government to provide that discipline. We need a discipline in washing our hands, in maintaining distance, in using gloves if necessary, disinfecting door handles where people might be. And we will get through this, of course, with some loss, but we will get through this with a disciplined approach. We don't need an authoritarian government, but we need to shelter in place, and we need to take it seriously.
Did you ever imagine that in your career you would have to be dealing with something of this nature?
You mentioned when we started this, I was involved with anthrax care back in 2001. And what a difficult time that was. And I felt like I was in the military at that time. And we were dealing with sick patients. We were dealing with terrorism. I thought it was all downhill after that. This is a challenge which is unimaginable. And I'm proud to be part of Virtua, running an almost regimented military operation to try to keep our patients safe. This is really unimaginable.
Well, Marty, I have to tell you that I am so grateful for dedicated experts such as yourself that are working tirelessly to help us through these challenging times. I really want to thank you for offering some clarity today around this very confusing and yet dynamic virus. You and all of those involved in this effort are truly here for good. So thank you for being here today.
Well, thank you for the honor of just having the opportunity to communicate. Thanks.
Thank you for joining us for this episode of Here for Good. If you liked what you heard, please leave us feedback and share our podcast link with others. Until next time, be well, everyone.